it's kind of crazy, right? French drink tons of wine, they eat tons of cheese, so you would think their cholesterol would be off the chart. So I actually have to say I don't know the research about it, whether their cholesterol is off the chart or not, but you would think. And they smoke like crazy. Again, I haven't been there in many years, but when I was there, both in the airports and, they probably changed all that now, but I know like Italians smoke like crazy and French smoke like crazy. And, a lot of countries, Japan used to smoke like crazy. The head of the Macrobiotic Society, Michio Kushi, was a heavy smoker, right? And he was he was macrobiotic. He was like a vegan vegetarian. So the thing is, it doesn't always follow in this linear pattern. So why are countries that have this kind of high fat, high cholesterol diet have lower incidence of heart disease? So again, it's not all about the cholesterol. It's not all about the fat, because we know there's good fat and there's bad fat. But I think a lot of it is what, we're calling now lifestyle medicine. What's your lifestyle and what's your level of stress? Because, we're like the most industrialized, nation, but we're also the highest stress. I mean, in Europe, they traditionally take like 1 to 3 months off vacation. When's the last time anyone that you know here was given a 1 month vacation? 1 month. I know sometimes people have the time, but no one's going to allow you to take it. It's like, well, take it in increments. Take a week, take 2 weeks. No one takes more than 2 weeks here. The first time I took a month vacation, I thought I was committing like mortal sin. And it was my own business, and it was so even more difficult for me. I can't imagine I would ever have been given permission, if I was working in a company that wasn't my own, to take off for a month. But it was the most freeing experience, because by the time you travel, get to where you're going, relax, and then usually it's time to come back home again, and you're maybe even more stressed coming back. So again, stress is, maybe we should not call it heart disease. Maybe we should call it stress. And stress as a manifestation, then, that the body, and particularly the heart, takes, the idea of the body keeps the score. So whatever emotions, whatever your psyche's going through, your feelings, I mean, whether they're expressed or not expressed, and the worst ones really are the unexpressed ones, the stress that you don't speak about, the stress that you hold in and tighten up. And you can just feel, when I say that, I could feel my heart contracting, because everything kind of goes into contraction mode. So when you feel that contraction mode, it's like the heart going into a spasm. And again, the heart is a muscle. And so the heart going into a spasm, what happens? You get that constriction of the, basically you're stopping the heart. The heart can go into an actual spasm. We're in a crisis for sure. We're in a crisis of heart health. We're in a crisis of depression. So we think, again, depression being from the brain. But, with all of the antidepressive medicine that's come out in the last 20, 30 years, why is depression rates increasing and not decreasing? If we have that magic pill, that magic cure that we can take one pill, well, guess what? There's major side effects from all of these antidepressive drugs. Serotonin inhibitors. The serotonin is the feel-good hormone, and we're doing a, trying to inhibit some of the pathways of that. So, common sense, like, why is this happening if we've got the magic pill? So the latest research with things like the antidepressant drugs, the most commonly used, is that, guess what? The side effects outweigh the positive effects. And we're not even really sure that serotonin increase or decrease is linked to depression. So we've been giving these pills that are all based on serotonin increase and decrease, and we're not sure, because psychiatry is the one specialty that has no testing for it. So basically, we've become guinea pigs for, let's try this, let's try that. So people might say to me, well, your patients are guinea pigs too. It's like, maybe, because if I give them a nutrient, or if I give them a detoxification program, or if I tell them to do breathing, or if I give them meditation techniques to do, that might be acting like a guinea pig, except, one thing, there's no major side effects, right? So I'm not giving them a nutrient, or I'm not saying take vitamin C and it may destroy your liver. I'm not saying do breathing and guess what? You might have a heart attack the next morning. No, nothing like that. So the first thing is, doctor, do no harm. And I think we need to revert back to that thinking. And really, my thinking from when I first, started practicing was I'm an educator. A doctor should be an educator first and foremost, because I want to help people learn how to take care of their own bodies, right? And so, and again, I'm not sure if this is true or not, but I remember reading something about ancient Chinese medicine where the doctors would just get paid regularly. And if their patients got sick, they wouldn't get paid because they weren't doing their job, right? And I thought, what a novel idea, right? So that the doctors could stay in business. We're not trying to put doctors out of business. I don't want to be out of business either. However, the idea is that it's more about prevention and maintenance. I mean, I'm really grateful that we have hospitals and that there's an emergency room and that there are people waiting to serve someone that's been in a car accident or whatever kind of accident, or they have a major, immediate episode like that. I'm really grateful for that. So I'm not bashing hospitals and I'm not bashing doctors, but there's a place for it that we need to kind of get back and start kicking ass, take back our power. But we can only do that if we learn about our bodies, right? If we don't know about our bodies to begin with, then we really know no preventative measures to be taking with that. So I want to move from the physical part and think now about, so where does breathing and where do we get that, what I would call coherence? So brain heart coherence. So we know with the mind, we can meditate. And when I say coherence, it really is kind of a steady state. It's like a steady wavelength that we want to do. And when we can have a breathing state, and the breath that I recommend is, breathing in, and again, this is common technique. And it's part of the Ayurvedic system. It's part of the Chinese system, Japanese system. I mean, breathing techniques vary a little bit on how you can do it. With yoga, there's alternate nostril breathing. There's Kapalabhati, forceful exhalation. But very simply is breathing in through the nostrils, holding, and counting. So holding, breathing in, count of 5, holding the breath, count of 5, and exhaling through the mouth, count of 10 or double. So if you're doing, if you want to start it slowly, you can breathe in for the count of 3, hold the count of 3, and then double exhalation, count of 6. And that alone, just that technique, they've done studies that actually create a calming effect. Breathing is really the very first thing and the simplest thing to do, because we all need to breathe. But when we say mindful, the idea is that we're actually kind of putting our attention to the breath rather than just going, and being frazzled. Because if you kind of can't do both at the same time. When you're frazzled and not paying attention and somewhat unconscious, that's the opposite of mindfulness, which means paying attention, right? Paying attention to the moment, and the breath keeps you in the moment. You could, under whatever stress you're experiencing, block it out, tune it out. I'm not going to pay attention to it. It doesn't mean, however, that your nervous system isn't experiencing it, right? Because maybe you've cut out listening, but your nervous system is still being sparked and fired, and you're in overdrive, right? It becomes that fight or flight mechanism where your body reacts, and it's like, when you get startled and you jump, like, again, it's epinephrine hormones and adrenaline that gets triggered, and that turns up your blood sugar, and it gives you that ability. Now, your blood sugar is pumped out. Now, it doesn't mean you have to eat something, because the blood sugar is stored in your red blood cells, and it's stored in your muscle, and it's stored in your liver. So the body has a mechanism where it's going to shoot out the glucose so that you will have the energy to run. So it's or fight or flight, because your nervous system has been triggered. So imagine that that's happening every day, every second in our lives, even if we've tuned it out. So it doesn't matter. So doing mindful breathing, doing meditation is really a way to kind of calm the brain and calm the heart. Hey, join me, because life will never be the same again. Are you tired, exhausted, stressed, overwhelmed, adrenal gland burnout, ready to make a change in your life, but just not sure how? I'm Dr. Nane Cheung, and I've been 38 years in private practice doing integrative functional lifestyle medicine. I have tools, I have resources, I can show you what blood tests to take, I can give you meditation and mindful techniques that you can do simply every day to make your body a better place to live. Because health is wealth, and you know it and I know it, and there's no time to start like today. So sign up now and let's get going. Let's kick ass together.